Good morning, everyone out there in Zoom land. My name is Beth Chapin, and I am a perinatal nurse at UCSF Birth Center, which means that I work in all areas, caring for pregnant patients and their families in antepartum, labor and delivery, and postpartum. And I'm going to begin this third trimester presentation by describing what to expect in labor. Go ahead and advance, thanks. If you think it might be time to have your baby, we recommend that you call our OB emergency department, also known as triage. An advice nurse will assess you over the phone to determine if you should come in. When you call ahead, you give us time to plan for your arrival. Next screen, please. And as you drive up to UCSF Mission Bay, you will pull into the circular driveway, which is here on the right, in the right picture. And that's a drop-off circular driveway where you can park temporarily. And then you will go to the right through the Children's Hospital and check in for the birth center, go up to the third floor and get yourself set and check in. And then you can move your car from the circular driveway to full-term parking. Next slide, please. And the question that's asked a lot is about parking rates. So I've posted them here for you, as well as a picture of our surface lot for parking. And that's the daily max there, $35. And then behind, if you were looking at the hospital right now, behind your left shoulder would be a parking structure. And you can also park in there. So there's ample parking for everybody. Next slide, please. So once you enter UCSF and our COVID and security, you're going to check in with security first, and you're going to be COVID screened. And we ask that you have a proof of vaccination or negative COVID test results within 72 hours of your checking in. And we understand that you may be admitted unexpectedly. So if it's an emergency or you're coming quickly, visitors will have 72 hours to get tested, and patients upon entry to UCSF, everybody gets tested. And then you're going to take the elevator to the third floor birth center and check in. And now we recently increased our visitors, so this slide needs to be updated, and I want to confirm that labor patients are allowed to have 2 visitors plus a doula for support. Okay, so that'll be updated next month, but that's a recent update. Next slide, please. So when you arrive, your first stop will be OB emergency triage department. And it's here that our team will assess you. This is a picture of one of our midwives. She's since retired. They'll be determining if you're in labor or if you can go home. And the average stay in this OB triage is 1 to 2 hours. It can be longer depending on your assessment and admission and questions. And then a question that we get asked quite often is, what is divert? And I just wanted to go over that we have a plan in place in the event that all of our rooms are full, which with full moons and high tides and any other energy that's going on in the cosmos occasionally happens at UCSF. So if our rooms are full, we have plans in place with San Francisco General, CPMC, St. Luke's, and other hospitals to open up beds for you and to make sure that you have the care that you need. So we have a plan in place in case we're full. Of course, we want to take care of you. We want you to be with us. But in the event that we are full, your insurance will be fully covered because it's considered an emergency, and we will make sure that you get the care that you need right away at a good hospital. So we have a plan in place for that. Next slide. So I'm going to start off with our antepartum. This is where our long-term care before labor, this is where our patients come. And then you can also begin your labor induction here in antepartum. and it's the quiet wing of the hospital. Every room in the birth center, with the exception of one shared room in our PACU, every room is private. They're quiet. It's furnished with your own private bathroom, a twin guest bed, Wi-Fi service, and a large flat screen TV, and big windows providing natural lighting and fresh linens. Okay, next slide, please. And then once your labor is in full swing, or if you arrive and your labor is in full swing, we're going to move you over to our spacious labor suites, which are adjacent. They're like just down the hall from antepartum and triage. And here, this is where you'll finally meet your baby. There's 9 large rooms in labor and delivery. They're the biggest rooms in the birth center. And each patient has their own care team with their nurse, an attending doctor or a nurse midwife, depending on your needs, a group of resident physicians, and we always have at least 2 anesthesiologists on 24 hours a day. And an anesthesia physician will visit you when you are admitted to discuss your pain relief plan and answer any questions that you have. And then as far as the equipment in the labor rooms, we have our beds, which convert to a variety of different positions that are specially designed for labor. We have all sorts of props and tools to support you in your labor, like birthing bars, physio balls, and peanut balls, so you don't need to bring your own. Our bathrooms are equipped with spa bathtubs, complete with therapy jets, but we don't offer water births. And then we do have mobile monitoring devices as well to allow you to walk around the room and be monitored while you're laboring. Next slide, please. And then I wanted to discuss a little bit and just show you the picture of some of the equipment that we use to monitor your baby and your labor progress and keep you safe. We have something called a tachometer, and this assesses your contraction pattern. It's the band up on the top right there with the little blue dial in it. And then we have an electronic fetal heart rate monitor to assess your baby's response to labor and your baby's overall well-being. That's your heart rate. And that one is the second band down. And we have wireless monitors that will tell us how your baby's doing and how your labor's going. Next slide. Oh, and then there's the labels. And then we get asked from time to time about IV access. And I just wanted to say a little bit about it. We have one guiding commitment that shapes every decision we make in your care, and that is healthy mama, healthy baby. And so we believe that IV access is important because that helps us be prepared to do any kind of interventions to keep you safe. We can offer you medication for pain, nausea. We can give you hydration through your IV as you run this marathon of labor. And we can support you and your baby with fluid resuscitation. Know that when we place the IV, after we do something called flush locking it, which means we can, it doesn't necessarily have to be attached to a line. It can just be tucked away and kept clean and locked off so that you can move around the room, and then we can attach medications or fluids as we need them. So it can stay like this lady, I believe, right here in the upper left is just got a flush locked IV. And she's laboring away. And then the one on the bottom actually has a line attached to it. Okay, next step. And I wanted to mention that there's 2 phases of labor, early and active. And I wanted to remind everybody that labor is a marathon and not a sprint for most people. Early labor is 0 to 6 centimeters dilation of your cervix. And I like to say this is when you still have your sense of humor, and it takes the longest amount of time. So we're patient with our bodies, as they prepare to give birth. And if you were comparing it to a marathon, it would be between 1 and 15, the first 15 miles of labor of the marathon. And then your active labor, 6 to 10 centimeters, is when things start to get intense and you're focusing and getting into your zone. You may need some good support here, pain relief, and you may lose your sense of humor, and we're prepared for that. And I lost mine when I was going through it. And this is usually mile 5 to 20 when you're feeling fatigue, and it's hard to keep your inspiration. And that's when we need to turn on the music and get the troops rallied. And then when we hit 10 centimeters, you can see the finish line. It's time to push. It's mile 20 to 24. And that with first babies, we push on the average of 2 to 3 hours. Next slide, please. Okay, and then if we click again, I think all my pain relief options will come up on the left. There we go. So nitrous oxide, used for over 100 years in the UK. They call it gas and air. And we were the first hospital on the West Coast to offer nitrous oxide actually piped into each room. So we attached to the wall for our gas and air, and it's 50% oxygen and 50% nitrous. So actually it benefits you in your respiratory capacity. Next, if you click again, we'll get the next IV pain medications, which we offer IV fentanyl in very safe doses. It can feel like you've had a cocktail or maybe two when you have the IV fentanyl, and it's not going to, both of these pain relief options are not going to numb the pain, but they are going to help you to step back from the intensity of the pain and manage it a little bit better. They just soften the feeling of it. And then the next one is, believe it or not, if we click again, a bathtub should come up next. There we go. And we find that laboring moms get a lot of relief from being in the bathtub. And if you're a tub person, you're going to love our tubs. If you're not a tub person, you don't feel comfortable in a tub, then I probably wouldn't suggest it. But the combination of the jets, the warm water, and the anti-gravity can really help soften you up and help you relax and even take a break from the intensity of the labor and get you further along. And then the last one, we click one more time, the gold standard is an epidural. And an epidural is very safe. I had it with both of my labors, and it's probably our most common pain relief requested option. And it is a bit of a game changer though, because when you have an epidural, then you'll no longer be able to walk back and forth to the bathroom. So we're going to be taking care of your urinary needs. We'll put in a catheter or just a temporary, or it's going to be a temporary catheter, but it'll either be a Foley catheter, which has a bag attached to it, or we can just empty your bladder with something called a straight cath once or twice, depending on how close you are to having your baby. And there's also no eating. You can only have clear fluids. So you can have broth and you can have clear fluids, but nothing that's got like orange juice with pulp in it or any kind of food, because it is considered anesthesia. And then last but not least, with the pain relief options, you can have them one at a time, not combined. All right, next one. And then physiologic birth and recovery, the golden hour. For vaginal births, you can expect immediate skin-to-skin contact through the first hour of life. And the caveat is that your baby is transitioning well and has a good, strong cry when they're born. If they need help, and occasionally they do, occasionally they're born a little stunned, then we have our 8th in the nation world-class ICN, or other hospitals call it NICU pediatric team, that we can call to the bedside in a heartbeat. They can be there in a matter of seconds to help assess your baby and make sure that they transition strong and well. And then as we're doing the skin to skin, so the baby's born, comes up to your chest and you hold your baby. And then we offer delayed cord clamping, which has many benefits for newborn babies, such as increased hemoglobin levels and iron stores and improved transitional circulation. Then once we clamp the cord, baby comes to your chest and you have what we call the golden hour. And you can bond with your baby, explore your baby, hold it close, keep it warm, and breastfeed. And we will assist you with all of that. And then after an hour, we'll move the baby to the warmer for measurements and assessments and the newborn medications. And families can expect to recover in the labor suite or post-anesthesia care for 2 to 3 hours before they transition to postpartum. Next slide, please. We're almost at the end here. And then if you click one more time, it'll come up with the title. I'm so fancy. So in the event of a surgical birth and a cesarean section is needed, we have 3 operating suites located in the birth center on the 3rd floor. So they are right within our birth center. And the birthing person is taken into the OR for anesthesia. And a member of the care team will come and retrieve the support person when appropriate, when you're comfortable. And then during the procedure, you can expect to have a curtain, and you can see it in the upper right-hand picture here where the baby is on her chest. There's a little curtain right there. And it has a clear plastic sheet next to it. So, and that's between you and the surgical team. And the curtain is dropped when the baby is born. So you can meet your baby and have that Lion King moment where they hold the baby up when it's born. It's really beautiful. And then after the birth, we also do delayed cord clamping in the OR if the baby is feeling good and responding well. And then the baby is taken to the warmer for assessments, and the pediatric team is at every, yes, the curtain is clear. When the surgery is happening, the curtain is opaque, like you can see here. And then when the baby's born, we drop the opaque part. There's actually 2 sheets to it, and so that you can see your baby when it's born. But then we put the opaque sheet up so that you don't have to watch the surgery. And then the baby will have a designated nurse attending the birth in the OR just for them. So we have a nurse for mom and a nurse for baby. And then I was saying that the baby's taken to the warmer and that the pediatric team is at every birth in the OR. So your baby will be checked out by the pediatric team as well. And then after the procedure, the family will recover together in the PACU, post-anesthesia care unit, and eventually move to postpartum. And before baby ever leaves the OR or any room for that matter, they'll receive a safety anklet called a HUGS tag with a little GPS tracker, plus labels from mom, and baby gets their own ID band. So they actually get 4 bands for security and safety. Last slide. Oh, second to last. How do you get ready for your visit? Think about your pain management. Think about how you would like us to care for you in that way. I strongly suggest that you bring a music playlist or something that you enjoy. If you're going to be induced and it's your first baby, you might even want to bring a game that you like to play because you'll be hanging out together for a while as things progress. And think about that golden hour of bonding, and if your partner will cut the cord. And then newborn medications that we offer. We will talk to you about erythromycin eye ointment, vitamin K, and the hepatitis B vaccine that we're now offering in the first couple hours of birth because it has protective benefits. I think it takes about 12 hours to get full protective benefits, and it's really important to keep your baby safe. And then your plan for breast or formula feeding. And finally, you can click please. We ask that you will wear a mask at all times, even if you are vaccinated and or you're testing COVID negative, just to keep everybody safe. Please cover your nose and mouth in public spaces and when your care team is with you. And we also ask that you minimize travel to and from your room, just to keep us all safe so we can keep taking care of you. Thank you very much.
Thank you so much, Beth. So right now we're going to take a little time to transition to our next set of slides. Brianna Fay is also another one of our inpatient team members who is going to talk a little bit about postpartum. And I think while they set up that time, I'm just going to kind of reiterate some of the questions that we're seeing in the chat. A lot of questions about divert, and I think the big thing that everyone should know, we can't predict it, so to give numbers and percentages is challenging. But the big thing is when you call in, they will take care of you. So that's the big thing. And the other thing is I see a lot of questions on, visitors and things like that. I'm going to put something in the chat and we'll also include it with the materials for this, but it's the UCSF visitor guidelines. This is where all the up-to-date information is. So this is where you're going to want to check, even leading up to coming in to see us. So I'll put that in the chat section. And just one more gentle reminder is this is being recorded, so you can review these slides, this recording, and we're going to offer the Q&A questions and responses as well. Okay. And it looks like we're ready to go. So Brianna, it's all you.
All right. Hello, everyone. My name is Brianna. Thank you so much for being here today and taking time this afternoon to listen. I am one of our postpartum nurses, and postpartum is the period of time after you give birth. Next slide, please. So our length of stay after a vaginal delivery is between 24 and 48 hours, and after a C-section is between 48 and 72. We have 24 designated private postpartum rooms, in addition to some additional postpartum rooms on our 6th floor. Our visitor policy recently changed per the Department of Public Health guidelines. So in postpartum, you are allowed 2 visitors. Your primary support person is allowed 24 hours per day, and your second person can visit between the hours of 10 a.m. and 8 p.m. With no alternating. So one additional person a day. We are also requiring that visitors show proof of a COVID-19 vaccination and or a negative COVID-19 test. It has to be a PCR test within 72 hours of visiting. We are, in addition to testing all patients, we do offer tests for visitors in the Gateway Medical Building Monday through Friday. We will be retesting patients every 92 hours. We ask that you kindly put your mask on when a provider enters your room, despite negative test result and or negative COVID test. Next slide, please. So this is in the birth center tour packet, there is a really helpful list of items in there. Please note that some of the information in that packet is a bit dated and we've made some changes since, but there is a good list in there of items that people like to bring. We do supply a lot of personal care items like disposable underwear and pads and ice packs and abdominal binders and peri bottles and breast pumps and supplies, and infant care items as well, like diapers and wipes and swaddle blankets. Most common personal items that I've found helpful for families are your own toiletries, comfortable clothes, a robe, shoes that are easy to clean, a going home outfit for your infant, the baby car seat, and some snacks. We do have a meal service at the hospital. You can order anytime between 7 in the morning and 8 p.m., but you must order. So if you don't order food, food will not come. You can also order an additional meal tray for your support person at an additional cost. Next slide, please. Okay, so we are working towards our baby-friendly designation. So what does that mean? Basically, you're going to be rooming in with your baby. That means that we really want to encourage bonding. We want you to do skin to skin. We want you to get used to your baby's cues, get used to providing all that sweet baby care. Once you are moved from labor and delivery to postpartum, you will be alone in your room with your baby for most of the time. So it's important to talk to your partner about expectations for responding to your baby's needs. We offer individualized feeding plans depending on your baby and you and your preferences. And we want to make sure that you are making really informed decisions. So please, if there are questions about your baby, infant care, breastfeeding, all of that good stuff, don't hesitate to ask. We do have a newborn nursery, and Beth touched on this a little bit too. We also have an intensive care nursery at some hospitals. It's called a NICU. Our newborn nursery we do staff our nursery with nurses who assist with various procedures such as blood draws, skin to skin during a C-section birth, and sometimes a short respite if you need a nap. In our intensive care nursery, that is a space that you would be separated from your baby in that instance, so your baby can receive the highest level of care that they need. Next slide, please. So we have a really huge team and you will meet a lot of people. So nurses, you will be assigned a nurse. Our nurses are with you for typically a 12-hour shift. They may change in the middle of the shift, kind of depending on clinical needs. Our shift change happens between 7 in the morning and 7 to 7:30 a.m. and p.m. Our nurses care for an additional 2 to 3 families besides yours. Here's the list of everyone that you will meet. So members of our OB team, nurse practitioners, midwives, doctors, students. We have a pediatric team that will be assigned to your family, lactation specialists, birth certificate coordinators. You could see the list here. Lots of people will want to meet you. I do want to point out that we did have a service pre-COVID called Bella Baby. It's a photography service, and some families have chosen to reach out to them individually outside of the hospital since we no longer offer that service inpatient. Next slide, please. Okay, so some goals for you. We want you to know that we are totally here to support you. Our nurses will do regular assessments on you, such as checking your vital signs and pressing on your belly and checking your bleeding regularly to make sure that you are healing and meeting expected outcomes. We will offer a ton of education, and I know Megan will go into this a little bit later about some more specifics about what to expect. But again, we're encouraging couplet care. So that's you rooming in with your baby, bonding, asking infant questions. Your bleeding, you really shouldn't be saturating more than 1 pad in an hour or passing clots larger than a golf ball size. Swelling is normal, stitches and hemorrhoids are all normal. We're going to work with your bladder and bowel function, making sure that you are staying really well hydrated, that you're trying to get up and use the restroom every 2 to 3 hours, even if you don't feel the urge to go, and really taking your stool softeners to make sure you're not straining. As far as pain management and postpartum, most of the time we offer ibuprofen every 6 hours around the clock, and sometimes Tylenol and other medications to help manage pain. And if, of course, with pain management, it's not a one size fits all model by any means. So if the regimen that we have in place isn't working, say something, because there's a lot of ways that we can make you more comfortable. Milk production, nipples, and engorgement. Oh my, you're really going to follow your baby's cues and capitalize on what your baby is telling you. And we definitely ask your bedside nurse for lactation support. I do want to address that giving birth is a huge life adjustment, and it can come with a lot of a whole range of feelings. And so taking the time you need to really reflect on your birth, and if there are any lingering questions or concerns, telling somebody so we can address all that before you go home. All right, next slide, please. Okay, and some goals for your newborn. Your nurse will also do assessments and vital signs on your baby. At 24 hours of life, we offer a state mandated test. It's called a newborn screen. This is a blood test and a screening tool that we do no matter what kind of testing you have during your pregnancy. We are also going to be performing a transcutaneous bilirubinometer, or TCB for short. It's a light test, and you can see a little picture of it here. It just clicks on the baby's chest and it gives us a number that might warrant blood work follow-up, kind of depending on what that number is. We check for jaundice with that. Immunizations and meds, Beth did touch on this a little bit. We are offering hepatitis B now within the first 2 hours of life, in addition to the vitamin K and the erythromycin ointment. I would encourage you to go to the CDC website and look at the vaccine schedule for newborns. It's also called VIS, a vaccine information sheet. It's a really helpful tool. And please ask your provider about the risks and benefits of these medications. These are standard medications that we offer in the hospital to all babies. We will do digital footprints with a tool called Certiscan, and you'll have access to these online. There is a hearing screen. You'll complete the birth certificate. You will be sure that you are clear about your pediatric follow-up appointments. A lactation and feeding plan will be very clear and addressed for you before you go home. I've heard patients recommend Baby Tracker as a good app to kind of keep track of when your baby starts eating and when they stop, and which side they nurse on, and any stools or wet diapers that they have. We do encourage you to get your car seat and open up the box and get it tested, and have the base inserted into the car and checked, and bring the car seat into your postpartum room. That will definitely help with discharge. We also offer circumcisions in the hospital if you choose to do that. Next slide. A couple things about caring for your newborn. So definitely encouraging skin to skin and bonding with both parents. It doesn't have to be the birthing person exclusively. Again, you will have an individualized feeding plan, and definitely ask your bedside nurses. We come with a lot of extra training to support you in your breast or chest feeding endeavors. So please don't hesitate to ask. diapering, safety, and safe sleep, we do recommend back to sleep for every sleep. So we will provide you with a bassinet that you'll have in the room. It should be a hard, flat surface, no pillows, wedges, heavy blankets, stuffies, things like that. This helps prevent sudden infant death syndrome, or SIDS. We are moving more away from bathing in the hospital, though we can offer a bath if it's indicated. There are some benefits to delaying the first bath, just in terms of bonding and milk production. I would say babies typically need to be bathed every 3 to 5 days with mild soap and warm water. And just a little sponge bath until the umbilical cord falls off. That umbilical cord will fall off in about a week or 2, and that's when you could actually submerge the baby. And following the baby's cues. So crying is typically a late sign of hunger, and Melanie will go over some additional feeding cues. And we have educational videos that you can watch in the postpartum room as well. You will see these 3 sheets. These are these Bumblebee teaching sheets. We have one for caring for yourself after a vaginal delivery, caring for yourself after a cesarean birth, and then caring for the newborn. So these are little teaching points that we go over with you during the course of your stay with us, and you'll get a copy of these in postpartum. Next slide, thank you. So on discharge day, we do ask that the car seat is in the room before today. There will be a final exam by your nurse, from our OB team, from the pediatric team, and our goal discharge time is before 11. We will be sure that you have follow-up appointments scheduled for you and your baby. Your medications are typically sent to the pharmacy of your choice. And there will be an after visit summary, which is some paperwork that will go over all of those discharge instructions about when to take your meds and what to watch out for and how much bleeding is too much bleeding. So you will get all of this listed for you. We will cut off those bands that Beth said that we're going to apply to the baby, and request a transport team to escort you downstairs. When your baby has to stay in the ICN, they do have accommodations for parents over there. That would be something you'd have to address with them. And when you have to stay, but your baby is discharged, that is still okay. The baby can stay in the room with you, and we can talk about that if that comes up. All right. So preparing for postpartum at home, I want you to really rally your support people. So consider a meal train, preparing meals and snacks, organizing pet care, having some emotional check-ins. Get to know your car seat and bring it in. There's a really helpful tool on this link here through UCSF's website about car seat safety, and I think it links the highway patrol too. There's a little video there that's good about the little safety checks you can do on that car seat. Decide on a pediatrician if you are looking for a pediatrician outside of UCSF. Have a breast pump if you need one. You please don't bring it to the hospital with you. We have all of the supplies there. Consider a pelvic floor physical therapist. This is not necessarily for everyone, but it is a really helpful tool for some people. And then consider postpartum support at home. So family, friends, doulas, nurses, therapists, physical therapists. What can these people do for you? It's okay to ask for help if someone wants to drop you a meal, watch the baby so you can shower, walk the dog. Any little thing like that can be really, really helpful. And do make it a goal to show up to your 6-week postpartum visit. And next slide should be the final slide. Yes, thank you so much. We really look forward to working with you and your family. And this is a lot of material. So, and you're going to get a lot of written stuff and a lot of experience. So remember that the goal is to get you and your baby home safely. And yes, thank you so much for taking the time to be here today.
Thanks, Brianna. All right, so next up is going to be Melanie Bose, and she is going to talk about lactation. And as she pulls up the presentation for that, I'm just going to, again, briefly talk about some of the things that I'm commonly seeing in the Q&A, and it's a lot about car seats, so it's a little bit different than our last one. And so just to reiterate, the slides are going to come out. You can see that link that Brianna was talking about. And I actually just happened to go on there as she was talking, and I think we will also include the little PDF that talks about the different places that you can get your car seat checked as well, and that can be included with the materials that you'll get today. Great, Melanie, you're up.
Hi, my name is Melanie Bose. I'm one of the lactation consultants at the Birth Center. Thank you for being here today. It's my pleasure to review and introduce the lactation services that we offer. Next slide. One of the biggest concerns of new parents or any parent is infant feeding. How do I feed my baby? What am I going to feed my baby? And who can I ask for help? The good thing is that we have a large staff that can help you. On any day or in 24-hour period, we have 1 to 3 lactation consultants seeing patients. We are all IBCLC certified. That means that we have about 1,000 extra hours of specialty certification that we have to complete in order to become a lactation consultant. Additionally, we're all registered nurses with labor and delivery, postpartum, home health, and or ICN experience. I think I counted in, I think it's now 100 years of nursing experience in the lactation office. That's a lot of years. Additionally, we have over 200 nurses who are also specially trained to help you feed your baby. And some of the UCSF Birth Center nurses are also lactation consultants, IBCLC certified, and we're very proud of them. Next slide. We know that new parents want what's best for their babies, and we do too. Currently, UCSF is working towards a baby-friendly designation, and that means that we are promoting the highest standard of infant feeding, which is human milk. We also are working towards reducing disparities in healthcare. That means that we provide information and education for parents so that they can make the best feeding choices for their families. We also offer hands-on help from the very beginning. Next slide. So what does that mean? That means we work with you to optimize your feeding goals and help you reach those goals. One of the questions that you'll be asked upon admission to labor and delivery to the birth center is, how do you plan to feed your baby? Please let your nurse know. You can change your mind. Please let your nurse know so that we know how to best support you from the very beginning. Once your baby's born, Beth already talked about this. We call it the golden hour or 2. We really recommend skin to skin. At this point in time, your baby is alert and awake and usually ready to eat. This baby here is this. So this is a cesarean birth, but we can help you even in the OR, help you feed your baby in that event. There usually is one nurse who is our resource nurse who can help you do that because your baby is born and alert and awake. Your nurse also can help you recognize feeding cues, help you with positioning and latch or hand expression if your baby's kind of sleepy. Next slide. Once you move to postpartum, the goals still are skin to skin as much as possible. That way you bond with your baby, you get to know each other. You learn to recognize when your baby's telling you, I'd like to eat. Rooming in just means that you spend the most time that you can with your baby. That way you don't miss feeding cues. These are all feeding cues. They're pretty obvious feeding cues. Babies open their mouths, stick out their tongue, try and suck on their fingers. Anytime they're awake, that usually means I would like to eat. Even if babies' eyes are closed, it doesn't mean that they are asleep. It just means that their eyes are closed. Anytime they're moving around or making noise, usually that's a cue. Even though it's subtle, I'd like to eat if you'd like to offer me some food. Really, we recommend infant-led feeding. Anytime your baby's asking, go ahead and feed your baby. The more you feed your baby, the bigger your milk supply and the faster your milk will come in. Next slide. So your postpartum nurse can absolutely help you with positioning and latch and help you recognize feeding cues, especially in the first 24 hours when babies are sometimes kind of sleepy. But they do give you lots of opportunities to practice latching and positioning. In addition to your postpartum nurses, there are also instructional videos that you can ask them to queue up. The instructional videos are on your OneView account, and they review breastfeeding, and they also chest feeding, and they also review pumping if that's what you're interested in learning how to do. All of our postpartum nurses have specialty certificate or specialty training to help you feed your baby. Next slide. So when do you need a lactation consultant? Like I said, there are 1 to 3 lactation consultants working on the floor in a 24-hour period. And we can certainly help you with your first baby. Most parents, this is your first baby. The question is, how does this work? We can help you with that. If these are your first babies, or if you have multiples, usually the question is, how does this work? We can help you with that too. It's a little bit more hands-on. A little extra help is needed. We can help you with that. If your baby is born a little bit early, that means under 38 weeks, usually those babies are pretty sleepy and they need a little bit extra help, and we can help you with that. If you need a breast pump referral, if your baby's preterm, you didn't quite get to your breast pump, or if your baby has to go to the ICN, or if you have Medi-Cal, we can help you with those referrals. Let your nurse or your provider know early in your pregnancy if you're going to need a prescription or if you need them to contact your insurance. Usually around 34 weeks is a good time to do that, just because, especially now, sometimes shipping is delayed. If you order your pump, you might have to wait 7 to 10 days. So sooner is better. You don't need to bring your pump to the hospital. We have hospital grade pumps if you need one, and your nurse or lactation consultant can show you how to use it. Or if you just need a little extra help, an SOS, let us know. We can certainly come back and we can help you. The other thing we can help with is a transition to home. It's good to have support so that you don't feel like you're leaving the hospital and now what happens? Who do I go to? We can help you set up an appointment with lactation or a support group before you leave. Next slide. You'll probably get this handout. These are some of the at-home or discharge resources for lactation. There's a Women's Health Resource Center. If you need to rent a pump, you can certainly call them. They are located on the 3rd floor of the birth center, just past the elevators. And it's a good thing to call either to ahead of time, either to, if you need to rent a pump, or if you want to join the milk group, the breastfeeding support group, you can call them, make a reservation. That is the support group that includes you and your baby and other families and their babies and a lactation consultant. It's a big Zoom call right now. Hopefully in the future, sooner rather than later, hopefully, it'll be in person again, but right now it's a big Zoom call. You get a lot of information because there are, you can ask questions of multiple people and a lactation consultant. You can also make a reservation online. If you feel or want one-on-one lactation support before you leave the hospital, we can help you set that appointment up. We can also give you the number. You can make your own appointment. It is the OB number, the general OB number. It's the 353-2566 number. You just need to let us know and we can help you out with that. And I think that's about it. Thank you very much for your time.
Thanks, Melanie. All right, so next up is going to be Megan Paul presenting some of the outpatient items, kind of what to expect postpartum, your visits, how you're going to feel. And then from Q&A section, not too many patterns here, so I'll just lead it right off to you, Megan.
Hi, everyone. My name is Megan Paul, and I am the nurse manager for OB and antenatal testing. And I'm just going to go quickly through these next slides. Now that you've given birth, Brianna talked about the immediate postpartum period. This will cover more of when you leave the hospital and the follow-up that you will get with us. Next slide. And so these are the things we're going to go over: postpartum care, recovering from your delivery, both vaginal delivery and a C-section, maternal mental health, when and who to call, feeding your baby, and then we will have time for the Q&A after. And I just want to note all of the information that I'm going to cover in these slides is going to be in the postpartum guidebook that you will get in the birth center, and it's also online at our Women's Health Resource Center website. Next slide. So what happens at a postpartum checkup? First, the postpartum visit is anywhere around 6 to 8 weeks, but you'll always want to contact your provider if you have any questions or you notice anything concerning. So during that checkup, there'll be a physical exam to check how you're healing. It's a time to address any questions or concerns that you might have, and bringing a list can help guide that conversation. They'll cover preventative care. So if you're due for cervical cancer screening, a PAP will happen during that appointment as well. And also counseling on birth control options. Just as a note, if you are considering an IUD, you'll want to be sure to let the scheduler know, because that appointment just requires a little bit of extra time. And this is also a time to talk to your provider about signing off to start, more exercise, physical activity, and resuming sexual activity. Next slide. So recovering from delivery. After a vaginal delivery, these are the common physical changes that you can expect. So vaginal bleeding or discharge, it's really normal to have bleeding or discharge for the first 6 weeks or more, and it just kind of depends sometimes on how active you were during that day. It should gradually lighten around 2 weeks, but it may start and stop, or may stop and start again. So you'll just want to, be watching that. Hemorrhoids, sitz baths, staying hydrated, eating fiber, stool softeners as prescribed in postpartum are all good ways to help care for hemorrhoids. Many women experience menstrual-like cramping, and this is as the uterus is shrinking. Also happens with breastfeeding. Soreness at the perineum is very normal. So ice during that first 24 hours postpartum, and then warm water, rest, that will help encourage the healing. You can also take ibuprofen, acetaminophen, or any other pain meds as prescribed by your provider. And that's even if you are breastfeeding. So you may notice also some changes in your bladder function. So your bladder muscles are stretching during this time, which may result in some urine leakage. If this is continuing after 6 weeks, you'll want to talk to your provider about that. And then mastitis is also something that we just like to cover so that and can be on the lookout. It is inflammation of the breast that may result in an infection or plugged duct. The milk is generally not affected. Symptoms include having a hard, red, painful area on your breast, fever over 104 degrees Fahrenheit, and any flu-like symptoms. If you are noticing any of this, you'll want to contact your provider because antibiotics may be needed for this. Next slide. So recovering from a C-section. So the first thing you'll want to consider is a C-section. Delivery is considered major abdominal surgery and just may require a little bit more recovery time. So you really want to be kind to yourself and allow yourself that extra time for healing. Numbness and pain numbness and pain at the incision site is normal and will diminish over time. You'll want to try not to lift anything heavier than your baby. It's important to be up and about to promote healing, but you also want to make sure that you're limiting your activity in those first few weeks. So you just want to start slowly and increase any activity just based on how you're feeling. If you're taking pain medication, it may be unsafe to drive, due to drowsiness and depending on the medication you're taking. So you'll want to pay attention to that. You're able to shower and bathe. You'll just want to keep your incision dry at all other times. And so the adhesive strips that will be on that incision will gradually fall off. But if they're still remaining after 10 days, you can gently remove those. Next slide. So lifestyle after recovering from your delivery. You'll want to pay attention to your diet. So continue to eat healthy, well-balanced meals. You'll want to stay hydrated, and that's really important too when breastfeeding, staying hydrated. You can continue your prenatal vitamins if you wish to. Sleep, this is always a hard one. You'll want to get as much as you can whenever you can, and have another adult at home with you as much as possible, especially during those first few weeks to help you get some rest if that's a possibility for you. Once your body's healed, you're the only one who can decide when you're ready to resume sexual activity. So although breastfeeding can reduce the chances of getting pregnant, it doesn't completely protect against pregnancy. So that is just something to pay attention to as well. Activity and exercise. So again, this is kind of one of those things, being kind to yourself. It took 9 months for your body to create that baby. And so it also takes time for your body to go back to, it may not go back to what it was before, but the uterus is shrinking and it takes time. So it won't be, your uterus won't immediately be back to pre-pregnancy size. So you'll just want to start slow, and 4 to 6 weeks after delivery, you can gradually start introducing other exercise into your routine. But again, do it as how you're feeling. And if you're feeling okay, then it's okay to keep going. Next slide. So we wanted to focus a little bit on maternal mental health. So depression and anxiety are common and can affect 10 to 20% of women in pregnancy and postpartum. It can begin before the baby is born or even develop months after the baby arrives. Baby blues are a normal part of adjusting to pregnancy and parenting. It's common to have those emotional ups and downs and to feel overwhelmed, especially in those first few days to weeks after delivery. Talking to family and friends, taking time to care for yourself, and really getting support around the house can help. So unlike depression and anxiety, the baby blues go away without treatment. Whereas depression is more than just the blues, it may be associated with feelings of worthlessness or guilt, loss of appetite or overeating, anxiety or panic attacks, dislike or fear of touching the baby, feeling overwhelmed or unable to take care of your baby, trouble sleeping or sleeping too much, low energy, difficult getting out of bed, loss of interest in previously enjoyable activities, and depression requires treatment to get better. Next slide. The good news is perinatal mental health disorders are treatable. And those treatments include individual and group therapy, support groups, medication, mindfulness, meditation, and yoga. Many antidepressant medications can be taken during pregnancy and while breastfeeding. It's the untreated mental health concerns that can last for months or years, but there are those options available to help. And 2 of the options support groups that we have here at UCSF is the Afterglow. It's a postpartum support group for new moms, and it's a 6-session series. And also we have the perinatal wellness program. The UCSF Perinatal Wellness Program provides comprehensive behavioral health services to a patient receiving prenatal and postpartum health care at our UCSF OB clinic. And so if you're interested in those services, you'll want to ask your provider. Next slide. When to call our outpatient triage. If you're noticing an increase in bleeding, you're soaking more than 1 pad an hour, if you're noticing foul-smelling discharge, fever over 100.4 degrees Fahrenheit or 38 degrees Celsius, new or worsening pain, including a headache that's not helped by pain medicine, problems urinating or emptying your bladder, signs of infection of your C-section incision with such as redness, opening of the incision, drainage, or foul odor, that's when you would want to call our outpatient triage group. And those nurses can be reached at 353-2566. So if the issues seem more emergent, our outpatient team may route you to our OB/ED for sooner services. Next slide. These next few slides are a reference just about feeding, breastfeeding, pumping, and storage. Again, this information is all in the booklet, but signs that your baby's getting enough milk at home is your baby's feeding 8 to 12 times a day in that 24-hour period. You can hear and your baby suck and swallow, has more than 4 wet diaper, or the baby has more clear or pale wet diapers by day 4. Your baby may have as many as 4 or more loose stools by day 5. And the baby appears calm and full after those feedings. The other thing is your breasts are feeling fuller prior to the feed, and then after the feed, they feel softer. So just a note too, we'll be watching your baby's weight closely inpatient as well as after discharge. Next slide. So feeding your baby, whether to pump or not. So you'll want to pump when you're separated from your baby, or maybe your baby's not latching correctly. Giving extra milk after breastfeeding. So if you're feeding breast milk, donor milk, or formula, if you're bottle feeding instead of breastfeeding, or even when you're thinking about preparing to return to work. When you will want to avoid pumping is when you're trying just to relieve that breast fullness, because pumping can help overstimulate. The other is when you're trying to start weaning breastfeeding. Milk production is actually maintained with regular breastfeeding and pumping. So pumping more will not help wean and dry up that milk production. There are a number of pumps that you can choose from. And if you're not sure, you can ask a lactation guidance or a lactation consultant for guidance. Next slide. Again, if you are pumping, this slide just covers how you would handle and store your milk. And the table on the bottom allows how long the milk is good for at room temperature, in the refrigerator, and the freezer. Next slide. So breastfeeding support options here at UCSF. Our lactation program, there are great expectation breastfeeding classes that are held via Zoom currently. There is the milk support group that is also being held via Zoom currently. We have our outpatient lactation clinic. There are breast pump rentals. There are numerous trimester-based informational videos, and as well as the community breastfeeding resources, which are all listed here and on our website. Next slide. If you are interested in an appointment with one of our lactation consultants, either video visit or in-person visits are available. You would call this number here, 353-2566 to schedule. They are seeing patients both at Mission Bay and Mount Zion. And then also, again, that our MILK, which is the Mother and Infant Lactation Cooperative Support Group. It's a free weekly breastfeeding and mother support group for moms and babies ranging in age from newborn to 6 months old. So it is also a great service and support. Next slide. And just thank you so much for attending this webinar. We really want to hear from you. So if you would take the time to complete this survey on things that we can improve on or things that you want to hear. And now we can have a little bit of time for a Q&A.
One thing I just want to add to what Megan just requested for that survey is that With the email that we're going to be sending out after this, we're also going to be asking for people to participate in a baby-friendly phone call audit where Baby Friendly USA would contact you. It's a very short call, but that is also going to be sent via that email. So looks like we have our first question. Is there an option for a 3-week postpartum visit with your OBGYN? 6 weeks is a long time without a check-in. So I think for that one right now, our standard is 6 to 8 weeks, but as Megan mentioned before, if there's something going on, if there's a concern, we're always going to see you. And so if you feel something is going on, you can either call our OB triage line, which is the main number, but then there's also an option number 4, which will get you directly to our nurses. And they can help with the scheduling and things of that sort too. Let's see any other questions. I'll give it a few minutes. I hope that means we did a good job by taking the questions from before and updating our slides. Let's see. Okay, here they come. What do most people forget to bring to the hospital? This is fun. Beth, are you trying to talk yet?
I would say maybe they don't forget it, but a lot of people bring white. And I would say if you could choose a darker color for your slippers or your socks or your robe, that might be a good thing. I would say probably the most important thing would be some kind of favorite snack or hydration in labor, because our food services close after 10 o'clock. I think pizza's closed, and the weekends, the hours are a little shorter. So overnight, if you have your baby, you might not have access to food. And so bring something that's going to be satiating for you. And in postpartum for that matter too. Just think about that. But we have a really great cafeteria when it is open, and it is open 7 days a week, but it is not open overnight.
I think I want to add on to this just from some discussions from Megan Duck. She also mentioned, again, the car seat, which we've been kind of talking about a lot here.
Mm-hmm.
The birth certificate, it's really helpful if you guys complete the information prior to coming in. And then also another thing I recently heard is like bringing your breastfeeding bra.
Yeah, we can help you troubleshoot all of that.
Anybody else from Inpatient want to chime in on that one? Okay. All right, so where can we find the recording and webinar material? So this is actually the first time we have recorded this. The last time was our very first time, and we didn't have it quite together to record it. So it will be on our Women's Health Resource Center website. It's going to be on the same page where all of our resources are. So it is going to take a little bit to get this put together, but all the other materials should be out to you pretty quickly, which will include the slides, the Q&A summary, and then some of the other addendum items. All right, what are the current pantry items in the L&D area? The popsicles were amazing last time. I like that.
We still have
We'll be sure to
popsicles.
have more popsicles for you.
Popsicles, ice cream, graham crackers, saltine crackers,
Lots
apple
and lots
juice.
of Jello.
Yeah, lots and lots of Jello. And I'm told that we will be getting orange juice back, but so far we're still waiting on that. But it's pretty limited, especially with COVID. So.
All right, any other questions? And then if you guys want, I mean, you can look at the tab that says answered questions, but also these will be sent out with everybody. All right, another question. During my pregnancy, I'm only seeing NPs. What's the best way to familiarize ourselves with the doctors that we may have for our labor? That's a tough one because it's hard to predict when you're going to go into labor and who's going to be on service. So I don't know, Inpatient, if you have any thoughts that you want to add to that.
Apologize for the delay. So your question is how to familiarize ourselves with the doctors that we may have in our labor. So what we currently do right now is we have a multidisciplinary rounding. So with every shift, in the beginning of every shift, you will meet your providers and they will introduce themselves to you along with, how many years of experience they have. And at that time, you can actually have the opportunity to ask any particular questions you may have. And of course, discuss your plan of care.
Do high-risk moms receive priority for UCSF in divert?
That's kind of a hard question to ask, but we take a look at every patient very carefully before we divert them. So if, for example, we have a inkling or idea of what's going on that particular day that we have to reschedule you, either, let's just say if you're scheduled on Thursday and we have an opportunity to bring you in on Wednesday, if you're a high-risk patient, we will do so. So we try our very best to be mindful of all of our patients, especially our high-risk moms.
Can we request for midwife attending if available?
Absolutely, yes, you can. Yes, you can. And I encourage you to do so during the multidisciplinary roundings before every shift.
Is the transport to the other hospital to be managed on our own? I think that's about divert.
Yes, usually you would, when you would call OB ED, and if the birth center was on divert, they would let you know which hospital to go to. So then you would drive to that hospital.
Any other questions?
I just want to clarify something. We've gotten a couple of questions about storing patient food since our private rooms do not have their own refrigerators. So I just clarified with our admin team that we are unable to store your food due to some precautions around COVID. So unfortunately, we cannot store your personal food for you.
There was another question too about where do you get the birth certificate ahead of time? You can't actually get a birth certificate ahead of time, but once you deliver, there are birth certificate coordinators who will work with you to complete the birth certificate. And if you're needing it quickly, there are ways to get it expedited, but they can't be gotten ahead of time.
There's a question in the chat in regards to bringing a stroller. I would say not at that particular time frame. You want to make sure that you have enough space, and space is a little bit limited. It's not as a large, spacious area that you can have your car seat, stroller, bassinet, and of course the sofa bed that we have for your support person. To unfortunately not at this time to please not bring in the stroller.
Can we bring a Yeti cooler to store food?
You can very well bring a cooler to be in your room, yes, and you can actually please be comfortable enough to ask your nurse for ice, and we will be able to provide ice chips for your cooler to make sure your food stays cool, or your drinks.
Just let's say some of the ones out loud that have come in. Does the baby get an MRN immediately? Yes, once they're born. Can we heat up food? Yes, the staff can help you heat up food. Is there a comfortable option for the spouse to stay overnight? Majority of our rooms offer a couch converted sleep bed.
I think one of the questions, I apologize if I am repeating it. If you are able, if the visitors are able to come and go and re-enter, yes, you can. The best thing to do is to make sure you complete the screening with our guest services every single time you enter the building.
This is a nice comment. So someone is asking, they said last time they came, they brought cookies, but they're wondering if it's still okay because of COVID.
Super sweet. Yes, it's still okay. We will just definitely have them in designated areas so that way they can partake in them. Thank you so very much in advance.
Are you able to say how frequently you're on a divert status this past month or two?
Absolutely. So, we want to just try to make sure that we are very transparent with our UCSF family. We are actively working on this. So I can honestly tell you that we have decreased our numbers significantly. Last month, I think we had like 4 families deliver outside of UCSF. So, and that's a tremendous improvement from the beginning of the month, year in January. So we are working on this very carefully. And if you are looking for percentage-wise, it's less than 2%.
Okay. Labor balls are often not big enough or have enough air in them, so hips are higher than knees, especially, okay, sorry, Patty is asking. So let's see, I'm due right around the holidays. Will this influence availability of staff or rooms?
So I get it. It's the holidays, but we totally understand and want to be here for our families. And of course, we are 24 hours, so staff is not decreased because of the holidays. We will be ready to serve you and provide you the best UCSF care possible.
I'm working on Christmas.
I'll see you on Thanksgiving.
Thanks, ladies.
We're ready. And if you're late, I'm working New Year's too.
See, we're ready to bring in your baby at 2022.
All right, we're approaching the end. So any last call items? So when you do get the email from our team with all these materials, you can ask additional questions. So I don't want you to think you have to quickly type in the chat area. We can send that to you. So just give it a few more moments. And otherwise, this will be the end of this webinar. We are going to be offering this monthly every 3rd Friday of the month. So if you feel like you want to just see it live again, or you want to tell other people, they definitely should do it. I think we've put most of the FAQs in these presentations, and you do get to see the awesome stuff that you will see in inpatient, outpatient. So thank you for coming. And we'll see you when you come in. Thank you, guys.
Thank you.
Bye, everybody. See you soon.
Thank you. Thank you.
Bye. Thank you, everyone.